Thank you and welcome to the show this morning. The topic this morning is the Tennessee Alcohol and Drug Association, and we're fortunate to have with us this morning to talk about the Tennessee Alcohol and Drug Association, the director of the statewide clearinghouse for the Tennessee Alcohol and Drug Association, Ms. Sharon Crockett. And Ms. Crockett, let me welcome you to the show this morning.
Thank you.
Ms. Crockett, what we'd like to do this morning is to talk about the statewide clearinghouse, of which you are the director, but at the same time to recognize that the statewide clearinghouse is the part of a much larger organization,
yes,
and that is the Tennessee Alcohol and Drug Association. Let's have you to talk about that, but first, let's get from you some information about your background and your education and some of the things that were important in eventually leading you to the directorship of the statewide drug clearinghouse.
Okay. I went to schools in Leavenworth, Kansas. I'm not a native Tennessean. I'm a native Kansan. I've lived here for 10 years. In Kansas, I attended Washburn University. I also attended Clark School of Business. And I have a lot of skill levels, and I have used those to my advantage, specifically in broadcasting. I spent 14 years in the media as a news anchor, talk show host, a disc jockey. I worked behind the scenes. I wrote copy, I wrote commercials, I wrote news stories. So I have that background that I bring with me to the Tennessee Alcohol and Drug Association. Our association is 20 years old. It was founded 20 years ago by people who wanted a professional association for folks in the alcohol and drug field. Specifically, the organization has several branches or divisions. There's membership services, there is lobbying, and there's also, we have our association and 8 others take part in an annual conference. That's one of the components of our agency. The Tennessee Alcohol and Drug Association has a contract with the Tennessee Department of Health, Bureau of Alcohol and Drug Abuse Services. The contract is for the statewide clearinghouse. That's the program that I'm the director of. The clearinghouse is 16 years old. It was founded in 1980, and we have been in existence for 16 years and have served the needs of Tennesseans statewide that whole entire time. You
know, Ms. Crockett, I think that all of that information that you've given us is very, very important in terms of trying to make people aware of the problem of drugs and alcohol in the state of Tennessee. But just from an experience point of view, from a person who has been involved in this whole process for a long time, let's get you this morning to give us some information about drugs in the state of Tennessee, meaning both drugs that are, quote, legal and drugs that are illegal. Let's have you, from your experience, to talk about that for a while.
Well, let me just give you how we extract our data. We received a grant enhancement from the Tennessee Department of Health 2 years ago for a service called the Tennessee Red Line for alcohol and drug information and referral. This is a statewide 800 number that's operational from 7 a.m. to 7 p.m. Monday through Friday. In order to meet our contractual agreements, we have to ask our callers certain questions. That is how we extract our statistics. And we don't ask questions about their race or where they work or anything like that. But we are interested in their age, the city they live in, the drug of choice, and the reason why they need help, if it's for themselves, a professional, a family member, or whatever the case may be. When we do our annual reports, we take the information quarterly because of state contracting. You do have to do quarterly reports to the state. They don't just give you money. You have to be accountable for it. We put together those reports at the end of the year. And for last fiscal year we just left, 1995-96, the #1 abused drug from our callers was alcohol, which is a legal substance in Tennessee. The #2 most abused substance was crack cocaine, followed by powder cocaine. Marijuana was #4, and multiple substances was #5. And the year before that, the thing that we noticed is different in our office is that crack cocaine has moved up as the #2 drug of choice. It was #3, so we're watching that in our office and kind of get the feeling that maybe one day it might take over as the #1 drug of choice.
Well, now, let's